Well, now we will discuss about scope of pharmacology. Let's we know what is the meaning of scope. Scope means extent of the area. If we extend any area, that is called scope. What is the scope of pharmacology? Pharmacology area, extended area of pharmacology. That means the area where it acts or it operates or it has power or it control. That means pharmacology where it is applicable, where it can operate, where it is implicable, and in which area it has control or it has power. So this is the scope, means the vast various branches of pharmacology. So if we see what are the main areas of pharmacology, there are four main areas. One is research area, another is academics, another is industries, and there are some special domains also there that are called special domain area. So let's we see the scope in research. The main scope in research is drug discovery. In drug discovery, when a drug is discovered, and in that discovery, preclinical phase and clinical phase, when a formulation or drug is prepared, developed, after development of the drug, this drug is tested in animal, that is called preclinical phase, and after animal study it is tested in human, that is called clinical phase. In both phases, preclinical and clinical, then they are experimental pharmacology. Mainly pharmacology is studied about the drug mainly studied about their absorption, distribution, how drug is absorbed, how it is distributed in the body, it is metabolized, and route of excretion, that is called ADME. And also it is studied the efficacy of the drug, how much drug is efficient, how much it will produce its therapeutic activity, and its toxicity. All these things are studied in the research. After coming research, next area is academics, in which will study the various subjects of pharmacology. In academics, mainly first thing area is pharmacokinetics. In pharmacokinetics, mainly that is absorption, distribution, metabolism, and excretion of the drug are studied. Pharmacokinetics, how the drug move in our body, that is from the absorption, how if we take it orally from the stomach or intestine, it will go to our bloodstream, then it is distributed, and after then it is metabolized by liver or kidney, where it is metabolized. Main metabolizing organ is liver, and it is excreted mainly through the urine. So these things are studied in pharmacokinetics. So this is one scope, academic scope of pharmacology. Next is pharmacodynamics. Pharmacodynamics means mechanism of action of the drug, how one drug will produce its action, therapeutic action, or how a drug will bind to the receptor. After binding to the receptor, it is produced the physiological action. That physiological action may be therapeutic actions and may be side effects. So this is studied under pharmacodynamics. Next, clinical pharmacology. What we mean by clinical pharmacology? Clinical pharmacology, where we will study the application of the drug. Application, how drug is applied for particular disease. For fever, commonly we will giving paracetamol, how this paracetamol is applied. So like this, different disease will giving different drugs, medicines. So that application is studied in clinical pharmacology. Next is experimental pharmacology. Another branch or scope of the pharmacology is experimental. The drug is experimented in the body, that is human or animal, that already we discussed in research, that is preclinical and clinical phase. So experimental pharmacology mainly studies in the animal like guinea pig, rabbit, rats, like this animals, and also human being, human volunteers. Next is pharmacotherapeutics. Pharmacotherapeutics, it is the scope or branch where drug is used for treatment of the disease. For treatment purpose, when a drug is given, and that is studied in pharmacotherapeutics. Another scope is ADR and drug monitoring. ADR means adverse drug reaction. Whatever the unwanted effects of the drug, if we are giving a drug for lowering the blood pressure, hypertension, and accept the lowering the blood pressure, if a drug is producing other effects that are called adverse drug reactions, and drug monitoring, like then observation is done. That is scope, another scope of pharmacology. Next scope is toxicology. Toxicology is some drugs can produce some toxicity in body. That different types of toxicity are studied. That is specific branches called toxicology. So we have studied the scopes under research, mainly drug discovery, preclinical phase and clinical phase. And next we studied academics. What are the drug actions on academics? Next, in academics, various scopes are there: pharmacokinetics, pharmacodynamics, clinical pharmacology, experimental pharmacology, pharmacotherapeutics, ADR and drug monitoring, and toxicology. After academics, drug is studied, means pharmacology is studied in industries. In industry, drug development, for preparation of the drug developed. That in drug development, how a drug is developed by molecular docking or computer aided drug designing, these things, this pharmacology is studied. Medical advisor. In industry, some scopes are there as a medical analyzer, drug analyzer. In there also they studied the details about pharmacology. Medical transcription. Medical transcription means converting of a prescription to a local language. Some physicians are there, suppose one is expert in Japanese language, and patients are Indians, they know Hindi, then that doctor's prescription and orders are transcripted, translated and explained in details to other language. That is called medical transcription. Another is marketing, medical drug marketing. Already we are familiar about the marketing of the drug. Product management. Product management also it is under one of the marketing. And contract research is research of the drug. Contract. Drug is given in the various field. So this is about the scopes in industries. And there are some special domains where a drug are studied. Some special branches are there that where the pharmacology are studied. One is most common is pharmacovigilance. Pharmacovigilance means this is the area in which identifications of a particular drug interactions, side effects, interaction after the giving a drug to the patient. So identification of any adverse drug reactions, Mainly it studies about the adverse drug reaction identifications, then assessment, either this is due to this drug or not. Assessment, understanding of the adverse drug reactions, and prevention. How we can prevent this adverse drug reaction, and we have to report through a pharmacovigilance committee. So it is these all adverse drug reactions are studied under pharmacovigilance. Another is pharmacoeconomics. Pharmacoeconomics. Here mainly cost of a drug is studied, cost analysis. In a drug, researcher will study to prepare a cost-effective drug. Drug should be less cost so that people can purchase the drug easily, and it should be effective. So in pharmacoeconomics, mainly cost analysis and cost outcome. Cost analysis and cost outcome are studied. Next branch is pharmacoepidemiology. Pharmacoepidemiology means epidemiology, large number of population. The effect of the drug, action of the drug is studied in the large number of population. How the drug action is varies based on the people to people, individual to individual, some races, among two races, among two genders, between the countries. Suppose one drug may not produce same effect as a Negroes, as a white or Caucasian, or the drug may not produce the same effect as a male and female. This epidemiology, it is studied. Next is chronopharmacology. Chronopharmacology is the branch or scope where the effect of drug changes based on biological time. So what happens if a drug is given in the morning time, it may not produce the same effect at the evening or night. So biological time wise, the effects or action of the drug may change. This thing is studied in chronopharmacology. So these are the present, whatever the present scopes, we discuss the present scopes of pharmacology. So in the near future, there are some more scopes of pharmacology are emerging, which are called future scope in pharmacology, which is proteomics, the study of protein, their structure and the function, like some enzyme, some receptor in the body, some macromolecules in our body, these things, proteomics. Pharmacogenomics. Nowadays, drug is prepared based on gene study, and pharmacogenetics. In studying the individual gene therapy, so that is the future scopes is coming as a pharmacology. And another in future is coming bioinformatics. By study using the computer tools, or various statistics, then we can analyze the drug action and their various uses. That is called bioinformatics. Another scope is their nanomedicine. Very small nano size of the drug is given for a particular reason, like some treatment of cancer in the brain or some genetic disease. For like these drugs are prepared is given in very small size, and that drug delivery, how the drug is to be inserted, so small nano size of the drug, that is coming in as a nanomedicine. So these are the various scopes of pharmacology. Thank you.